Now that you have been introduced to the model, let's review the ultrasound basics pertinent to this project. Ultrasound images are generated by the reflection, deflection, or absorption of sound waves, which come from the probe. How the sound waves reflect largely depends on the density of the tissue being imaged. The more sound waves are reflected, the brighter or more echogenic they look on the screen. Dense material like bone or bladder calculi will reflect a lot of sound waves and create a brighter image. The more sound waves are absorbed, the darker or more hypoechoic they look on a screen. Soft tissues like the spleen and liver reflect less or absorb more sound waves than bone, for example. They will therefore appear as varying shades of gray on the screen. The lumen of a urine-filled bladder essentially appears black on your screen as fluid absorbs most sound waves. Ultrasound gel facilitates the transmission of sound waves from your probe to the body cavity or model you are scanning and optimizes the image you are creating. This is the ultrasound machine that you will be using for this study. The image will be optimized for you prior to starting. You do not have to adjust the depth, gain, or focus. In addition, a probe will be given to you and lubrication will already be applied to your model. You will, however, need to learn how to hold and manipulate the probe to scan the model, orient yourself on the screen, and measure the long and short axes of shapes embedded in the model. Pick up the transducer and grasp it with your dominant hand using a pencil grip. Hold it close to your body with your elbow at 90 degrees to maintain a quality image and a good ergonomic position. So that you don't have to reach too far with your arm, situate the model next to your dominant scanning hand. Position the screen in front of your face so you can scan and concurrently watch the screen without inducing neck strain. Only apply light pressure as necessary to view the structures in the model. Applying too little pressure will result in lack of contact and may prevent you from visualizing the image. Applying too much pressure may create distortion of the structure you are imaging and long-term may contribute to injury or model damage. Keep the transducer vertical to the model surface at all times. Move the transducer over the model in a systematic process, ensuring you cover the entire model. When you come across a structure, sweep the transducer up and down and from side to side at different angles to assess it thoroughly. Observe the edges and surface of the structure in 2 dimensions, or axes. These types of movements help you to effectively assess all parts of the structure you are scanning. Which is the top versus the bottom of the screen? Think of the probe as a flashlight shining a beam down through your patient. The patient is laying on their back, so when you place the flashlight on the abdomen, the beam is shining from ventral to dorsal. On your screen, the near field is ventral, or superficial, and the far field is dorsal, or deep. Which is cranial, aka towards the head, versus caudal, towards the tail? And what's left versus right? Note the indicator notch on your ultrasound probe. Then note the indicator on the top left corner of the ultrasound screen. These 2 indicators always correspond with each other and will help keep you oriented while you are scanning and changing planes. For consistency and standardization, place the probe on your patient with the probe indicator pointing cranially. The screen indicator will be on the left side of the ultrasound image. And because these correlate with one another, the left side of the screen is cranial and the right side of your screen is caudal. Now rotate the probe 90 degrees so that the probe indicator is pointing to the right side of the model or patient. Remember that the patient will be laying on their back. Now the screen indicator represents the right side of the patient in this transverse plane image. Ask yourself 2 questions. Where is the probe shining from? If it's shining ventral to dorsal, then that will correspond to the top of your screen being superficial and the bottom being deep. Where is my probe indicator pointing? It will always correspond to the indicator on the screen. How do I find my planes? A long axis, also called longitudinal or sagittal plane of a structure, can be assessed when the probe is placed parallel to the long axis of the structure. A sagittal plane divides an object into left and right. By rotating the ultrasound probe 90 degrees, you place the probe perpendicular to the long axis of the structure, which creates a short, also called cross-sectional or transverse plane of a structure. A transverse plane divides an object into cranial and caudal, or top and bottom. By imaging both of these axes, you understand more about the shape and symmetry of the object you are scanning. It is common practice to scan structures in multiple planes. Sometimes measurements of the structures in each plane are obtained and compared to a set of normals, which help to determine pathology. After you have positioned the probe to obtain the axis of interest on your screen, for example, a transverse axis, hit the freeze button. This will pause live mode scan and keep a still image on your screen of the last thing you scanned. This image will stay on the screen until you release it again by hitting the freeze button a second time. Using the caliper tool on the ultrasound machine, you can now take a measurement. To do this, move the trackpad ball to the first side of the structure you intend to measure. Hit the select button. This button is located just left of the trackpad ball. This action will mark the first point of your measurement. Then use the trackpad ball again to stretch the caliper across the area you intend to measure, and hit the select button once again to mark the second point. The size of the structure will be in centimeters on the bottom left-hand corner of your screen. Hit freeze again to return to live mode. Now that you understand some ultrasound basics, you are ready to move on to the practice model. You will have up to 20 minutes to practice these skills and familiarize yourself with scanning the model before moving on to the testing phase. Do your best to perform these tasks and don't get discouraged if you find the tasks difficult. Ultrasonography is an art that takes years to learn and perfect. Thank you so much for participating in this study. If you have any questions, please feel free to ask them at any point.